certain professions have a culture that really has overvalued, I would say, the putting your head down and getting your work done, and which is fine in the moment. Obviously, day to day, that's what we need to do. But the idea that you would not have any effect on your emotional or physical or mental well-being, after not processing some of the things that we see because of the profession we're in, is just so misguided. We looked at this in a study because we wanted to understand with emotional stressors, and this was a study particularly of physicians. And I think physicians, I'm generally talking about the whole healthcare team, but there are some specific needs unique to the culture of physicians that, so I think some of the studies are on physicians in particular. But as this particular study was, that showed that in response to emotional stressors, physicians wanted to talk to colleagues. And so peer support would be support from colleagues, not specifically non-mental health professionals. Why? Because people feel like a lot of the stressors they're experiencing are from their, kind of occupational hazards rather than I'm having a mental illness issue. We also know, of course, people do need professional support from mental health practitioners sometimes, absolutely, and other forms of what we call further resources. But what formal peer support does is it bridges the gap between that sort of informal, hey, how's it going, which is, I would call necessary but not sufficient, and then actual formal professional resources. And it's well accepted to be able to have conversations, even about very emotional and emotions and also vulnerabilities with your peers because you feel safe. So it's really psychological safety, I think, peer support provides.